Had a pretty interesting case and topic come up today, and this is one that frustrates me to no end. So if you have been on medication before or you currently are on prescription medications, then this is one for you. I was taught my pharmacology course by UBC Pharm. Two awesome guys took us through all the ins and outs of the pharmacology world in order for us to get our pharmacy prescribing license. And one of the big takeaways from that course that I did over the course of 2 months was, is the drug causing the symptom? Patients come in all the time with symptoms, with difficulties, with chief concerns, and it was drilled into my head from UBC Pharm, the very people that teach a lot of the medical doctors in British Columbia. Is the symptom coming from the medication, or is it a side effect of the medication? I don't think this question is asked enough, because the drugs in this province are prescribed like candy, and no one ever questions it. Is this causing side effects? Is this going to cause symptoms? Because inevitably when those symptoms do come up, and they're already on a few medications, what happens is more medications just get added to the list. So we end up in this huge mess. What's also not talked about is the nutrient depletion that a lot of these medications cause. So you might be on something for 5 or 10 years, and then you find out way down the road that it's depleting your magnesium, your zinc, or your B vitamins, which are crucial for you to have a optimal and high functioning system. So I had a case in earlier of a patient experiencing dizziness. She was put on blood pressure medications right around the time the dizziness started. On the bottle, it said may cause dizziness, because if you drop blood pressure too aggressively, you can end up with dizziness and lightheaded symptoms. No one is doing anything about this. She brought it up to a couple people and nothing has been done. So you can imagine the frustration I feel when someone has been put on something, not had the drug dose switched, not had the drug class switched, and not talked about the potential side effects that she is experiencing. And then on top of that, I introduced the topic of nutrient depletion to her. All this is brand new and it's completely glazed over. There's no PAR-Q conferences done, which is procedures, alternatives, risks, and questions. This is a time where the physician and the patient can have an honest discussion about what is the benefit here, what is the risk, do you have any questions about what I'm about to put you on? That process is simply not happening, and then people are ending up in really rough shape. And then another drug to the list, another drug to the list, and so on. So if you're on any medications at all, you want to learn the ins and outs of the side effects. You also really want to know what are the nutrients that this drug might be depleting, and maybe I want to be on that supplement if I'm going to be on this drug long term. But honestly, as a naturopath, I have a prescription pad. I rarely use it. I strive to get all my patients off medications, because drugs completely take hold of our physiology and it pushes certain pathways that were not intended. So we do not need them long term. In many cases, they're great short term in times of crisis, or when people are going through really rough patch with their health. They can be absolute lifesavers, but I think deep down the goal should always be, how can I get this drug to the minimum effective dose, or better yet, how can I remove it completely? That's where we come in and help educate people on the side effects. Not just, okay, let's put you on this, but what about the discussion around how do we get you off it? That's where we really shine. We can do reverse tapers with people. We can supplement with herbs, nutrients, and botanicals, so that we are actually pushing that similar pathway in a natural state, so that as you bring the drug down, you can bring the natural remedies up, and you can balance people long term without these medications. So it's not just about how we can put someone on it, but we really should be thinking, what are the side effects, what are the nutrient depletions, and then how can we start and long term prepare to get someone off this drug long term. If you have any questions about the drugs that you might be on, the medications you've been prescribed, and how they might be affecting your system, you need to reach out to me, because it's unlikely you're going to get the answers you need. But I encourage you to do research and figure out what some symptoms and side effects might be, and some supplements to consider, and then we can absolutely sit down and discuss it. This is a very important part of health that is rarely talked about. Lots of people put on drugs, but the big question is, how do we get them off and support their system while they take it? Have an awesome day, and we'll chat soon.